Welcome, everyone. I'm Joyce Barnathan, President of the International Center for Journalists, and I want to welcome you to our Global Health Crisis Reporting Forum for what promises to be a fascinating series called Lessons Learned Reporting on a Pandemic. Today, we will look at Taiwan's successful efforts in dealing with COVID-19. By all estimates, Taiwan should have been hit very hard by coronavirus. After all, it's only across the strait from China. Instead, Taiwan is a resounding success story. In a country of 23 million, it has seen only 480 cases and 7 deaths. Having learned from its experience during the 2003 SARS epidemic that also began in China, the government used advanced technology and effective coordination between its public and private sectors to thwart the spread of COVID-19. And now the country is almost back to normal with relatively little damage to the overall economy. And U.S. Secretary for Health and Human Services, Alex Azar, recently visited Taiwan to see for himself the remarkable results. In this special event, we will speak to the Director General of the Taiwan Centers for Disease Control, Mr. Jih-haw Chou, to find out what other countries Dr. Jih-haw Chou, to find out what other countries can learn from Taiwan's experience. So let's begin. One of the reasons Taiwan has been so successful, Dr. Chou, is because you read the signals from China about the existence of a new virus very quickly. At that time, China wasn't telling the world much about how serious this strain of the virus was, and most of the world, including the WHO, wasn't reacting. Now, I know Taiwan is not a member of the WHO, but I'd like to know, tell us why you saw these signals and why you took early action.
Yes, Taiwan has a deep panic from the SARS outbreak in 2003. From then, during that outbreak, we have 347 people ill and 47 people died during a very short time. After that, we have lots of imported cases from mainland China about of avian influenza cases, for example, H5N1, H7N9. So the Taiwan, our health authorities, or even our press, media, our whole society very concerned about the disease outbreak news from mainland China. So we are also always keep alert on any information, particularly infectious disease information from mainland China.
Right, and so you heard in December that there was some strain of the disease, right? What did you do? I mean, you did have that horrible experience with SARS, which was quite a deadly virus. So how did that help you prepare for COVID-19?
Yes, we've heard about that information, and we quickly instituted some quarantine action. We made the board quarantine on the December 31st, and we mobilized our team on January 2nd, and then our president called on the National Security Council very quickly, so that the whole Taiwan society mobilized very quickly.
Wow, that is very early because we weren't really mobilizing until March. So you were mobilizing in very, very early January. Did you go to the WHO with your concerns?
Go to this year?
No, when you found out about the virus, or you heard about the problems from China, did you go to the WHO with your concerns?
Yes, we received this information. We we sent a message immediately to WHO and to ask them what's going on and looking for the further information. However, we waited for a long time. We did not receive the concrete answer from WHO. They just let us know that they will check it out.
So you didn't wait for the WHO, in other words, and just jumped into action,
Yeah,
right? One of the first things that you did was put in a travel ban from China, correct, or from Wuhan? Is that correct?
yeah, we monitor the information about the international news about the infectious disease very closely, and we found the increasing number of cases occurred in Wuhan or in Hubei province and spread to Guangdong and other other provinces. So we respond very quickly and decide to ban the travel from from mainland China.
Right. What other actions did you take at that time? Sorry. What other actions did you take at that time besides the travel ban? Because you had a travel ban very, very early on as well.
And we quickly established our system. We activate our Central Epidemic Controls Commanding Center, and we call on the multi-ministerial meetings, and we mobilized and we set up how can I say it? We ask our hospital to make preparation for to receive the patient, treat the patient, and our laboratory to make the test for suspected case.
Right. You, at the time, early on, you didn't have enough protective gear, PPE, including masks, right? But you managed to solve that problem. How did you solve the PPE problem, and what role did private sector and new technologies play in this effort?
Yes, after SARS, we also faced the same, during SARS, we have the same problem. So we learn experience from SARS. We stockpile our PPE from that time for at least 2 months for the medical needs. And however, it's not enough because our people, our citizens have the custom to wear masks usually. So we, our Ministry of Economics quickly to help our factory to manufacture the mask very quickly. I remember the capacity of manufacturing in January is more about 1.8 million a day. And at the end, in the end of the May, their capacity has increased to 20 million a day,
Wow.
about 10 times. And we also optimize our distribution to our citizens. And so we use the so-called, we provide every citizen opportunity to obtain the 9 masks 2 weeks. That will keep and keep the mask price very low, and to guarantee everyone has the opportunity to obtain the mask they need, and very conveniently they can obtain the mask from our convenience store or the drugstore everywhere.
Yes, that was a big difference than what happened here and is still happening here, to tell you the truth. Were you importing most of your masks at the time from China?
Before this outbreak, we import a lot of masks from China and the Philippines, but after the occurrence of the outbreak, and they banned the export of the mask, so we have to make it by ourselves.
Right. And did you have private enterprises volunteering or giving, or did you give them incentives to produce the PPE?
Yeah, we have some company to produce other PPE, and some of them did not have the technique, but our Ministry of Economics helped them to establish their ability very quickly.
Right. I thought it was interesting that you said you stockpiled a lot because of your experience with SARS. I guess that would be a recommendation to other countries to make sure that they stockpile enough PPE just in case there is a future outbreak, correct?
Yeah, I think it's very helpful. But from this pandemic experience, we will recommend stock some amount for the use of the mask for other than the medical need.
Right.
Because
did you find that Taiwan citizens were hoarding masks? Was that a problem where they were hoarding masks?
Oh yes, some people will stockpile it, but we have very strict law to inhibit this behavior.
What about the other parts of the PPE, like swabs and other health supplies? Did you increase those as well?
Yes, Ministry of Health also helps our manufacturers to have the ability to produce the other PPE and help them to obtain the material, the raw material for this PPE.
You know, testing in many countries remains a major problem. And I'm very curious how you were able to ensure there was a sufficient number of tests. I read that in March you developed rapid test kits that give results in 15 to 20 minutes. So first, how did you ensure there was enough tests? And tell us about this test that gets results in 15 to 20 minutes. How accurate is it? And are you exporting them?
Yes, we have some tests developed by the local companies, and as I know, their accuracy is pretty good. Their sensitivity and specificity is pretty good. Some of them are exported, and we always try to make the testing convenient for both physician and the general public. And if physicians suspect a case of COVID-19, they can make the test, and the testing fee is paid by the government. And people also can receive the test by their own money. And we always closely monitor the positive rate of the testing. If the positive rate increase, we expand the scale of testings. If not, we keep the small size of the testing. But we did a very exhaustive case investigation and find the possible contacts, and we test all contacts very quickly, maybe in 24 hours. So we our action is very quickly. I think that's the key.
Right. Well, contact tracing has been a problem in our country. How have you managed to make it so successful in Taiwan?
And we have lots of surveillance systems. Our surveillance systems are pretty good. And when we receive a case, we have we call the infectious disease physician to do the case investigation very quickly, and we quickly find all possible contact. They may be the source or may be infected by the case, and we found it. We tested it immediately and isolated. And for those contacts without symptoms, we will keep them quarantined for 14 days. And we have a very good quarantine system to ensure they are staying home.
Tell me about the quarantine system.
And our quarantine system, that's all contact of the case or the people returning from entered into Taiwan have to receive the 14 days quarantine. When they arrived in Taiwan, if they have symptoms, we will take specimens and in airports and send to the hospital for further evaluation. Other people have to receive the home quarantine for 14 days. After 14 days, they have the 7 days health management by themselves. If they have any sign of any symptoms, they have to report to health authorities, and we'll take them to hospital for further evaluation. And during quarantine, we have people to call them and to ask for any symptoms or need any help. For example, we can provide meal or the medical help, and even we can we can send people to collect their garbage, and we manage them, and we also provide service. That's why our quarantine system is successful.
You've clearly invested a lot of money in it as well.
Yes, we spend a lot of money in quarantine, but we found it's very helpful. Testing is not enough. Quarantine is the key. If we make a test at this moment, we just guarantee these people now is not excreting virus, but we cannot guarantee 2 days later they will excrete by shedding virus. But we keep them at home 14 days. We can sure they will not shedding virus and spread virus.
Do you ever experience people who do not want to share their contacts with you?
I think it need technical. I think we have trained a group of very good physicians and investigator to do the case investigation. They will try to let the contact to tell us the truth. Of course, some of them will not tell us the truth at the first time, but we will check it again, and we have other information to check whether they tell us the truth. We'll ask their other relatives or their friend to recheck the correctness of their information.
Yeah, that sounds very widespread and deep. So you don't just depend on somebody's word or not. You can go deeper and find out from family and friends what they know. Do you have issues with privacy, that people are saying you're invading my privacy? In the US, we have invasion of privacy issues, independence issues. You're stepping on my independence. Do you have that kind of issue in Taiwan?
Of course we have. Of course we have it, but we try very effort to explain to people why we need this information, and how we will use it, what's our purpose, and we will guarantee the scope of we use the information they provide, and we always keep we also keep our action has a legal base, have legal base, and we keep very close communication with the general public. We have press reference at least once a day per head. I remember we also have 3 press conferences a day, and we always keep communication with the general public. And the Central Epidemic Commanding Center, the supporting rate is as high as 94%. Wow. So we receive the confidence from our general public. Of course, we have challenge, but the people accept it.
Yes, that's a very high rate and very impressive. Let me ask you about your communications with the public. Who did the communicating? You said you had as many as 3 press briefings a day. Were these scientists, or was it you at the CDC, or was it politicians talking to the public? I'd just like to know the communication strategy to get 94% of the population supporting you.
All of us, our political leader take their all opportunity to ask people support government's actions and explain why. We have press conference every day to explain what we do and why we do it. And we also have the medical experts showing in our press conference. In addition, we have a 1 minute video in television, in all channels of television every day. And I think lots of medical experts are invited to showing in the video and increase public's confidence on us. In addition, we also have very close communication with medical societies. I think medical societies is very important, target of communication. Winning their support, I think most of the people will support us.
I see. So let me just go back to the tests that I asked you about, this 15 to 20 minute tests. How accurate are these tests? Are they 90% accurate? Do you get false positive, false negatives?
And for the antibody test, we have not licensed any antigen test. We only have antibody test. As I remember, the result is comparable to the big companies of the world. I think those results are comparable.
You also said that at airports, you monitor, excuse me, you monitor passengers coming in. How do you monitor incoming passengers?
The first, we ask the traveler to make the health claim first. And in addition, we have a temperature checker in the airport. Then we have healthcare professionals in the airport to ask to check their physical. If they don't feel well, we have doctors in hospital in airport to check their health status to decide whether send them to the hospitals or to send to home quarantine. So that's our screening process in airport.
I see. Well, Secretary Azar recently visited Taiwan, and I'm curious as to how that trip went and what recommendations you made to him and any offers of help that you may have made.
We just introduced what we did in Taiwan to him, and we also emphasize every society have their own culture, and any action must be culture friendly. And we have Taiwan is lucky this times because we have SARS experience. So our general public and the citizen easily understand what's our actions. I think Dr. Azar is also very interested in some IT technique we use in Taiwan, and we also introduce them. I believe the United States can do well, but we also let him know about our efforts in connecting systems. For example, the immigration system, the healthcare system, the computer system, connect them together and to use for the case tracing.
Yes, that's interesting. Taiwan does have a fairly sophisticated national healthcare system. As I understand it, all of your medical records are electronic. How did that help you track the virus?
We benefit a lot from the National Health Insurance information system. So we used them to make sure our mask distribution system is fair. Everyone have limited amount, can have a very limited amount of mask for every week, and in addition, we also use the National Health Insurance information system for hospitals. They can check the people's travel history, because they, particularly the foreign travel history, and then make the physician more alert about the cases and suspect whether the patient in front of him or her may be infected or not. And we also very benefit from the health insurance information system that we we can recheck the information provided by our contact or the cases and check their where they go and make our investigation more completely.
Let me just ask for a clarification here, because did you say that doctors can check electronically where their patients have traveled? Doctors are linked up to immigration and control centers so that they can see where everybody's traveling?
Yes, we download the information about the foreign travel history. That if people have a foreign travel history in 14 days, they will make a mark, just a mark on the National Health Insurance computer system. And the people, when doctor have check the National Health Insurance card, they can find, oh, he has travel history, just all, that's all. They can keep them alert. But if the patient is the people under quarantine and they did not follow the rule, stay in home, the doctor also can find it and notify us to treat it.
Well, how does the doctor know whether the patient's not staying at home?
Doctor don't know it because every people under quarantine have a mark on the National Health Insurance systems, and just let doctor know of these people is under quarantine. They should not be here, and the doctor can keep alert because they may be they are very probably infected people.
Many countries don't have such strong healthcare infrastructures. So it's difficult, it seems to me, in some ways, to copy or replicate the Taiwan success because you've got all these very sophisticated systems in place. Is that right? That not all of it can be replicated.
Yes, it's very convenient for us because we have a very good information system.
You said that Secretary Azar was very impressed with your IP success. What is it about your information, what is it about your technology that he was impressed with?
Oh, he's very impressed. We make the information, we connect lots of information systems together and to use in contact tracing, use in quarantines, and use in prevent hospital infections. He's very impressed that.
It is very impressive, I must say. You seem to indicate that Taiwan is already a mask society. People are used to wearing masks. In some countries, just the wearing of a mask has become politicized. That was not the case in Taiwan, is that correct?
No, it's not the case because we have a deep panic from SARS. During SARS, we were taught to wear masks in winter times or in epidemic, and I think most of our citizens receive this habit.
Let me ask you about a future vaccine. I know Taiwan is working with the National Institutes of Health in this country on a vaccine. What's the status of that initiative? And when do you think we will get a reliable and safe vaccine for COVID-19?
Mm-hmm. And we have 4 vaccine company to develop the vaccine, but the speed of development is a little bit late comparing to some company like Moderna or AstraZeneca. And I remember one of our vaccine company had their vaccine in phase 1 clinical trial, others still in preclinical stage. So we are trying to find some a little amount of vaccines we hope we can have a little amount of vaccine before the end of this year. I believe our vaccine companies will produce the vaccine. They'll mass a lot during next year, particularly after the second season.
Yes. Are you preparing for another outbreak in the fall during the flu season?
Yeah, that's a great challenge because I think we expect there will be an outbreak during the winter times, during the coming winter times. So we are rechecking our preparedness work. For example, we are checking our hospital preparedness and health education and others. We also have a mass immunization program for flu vaccines because they may occur at the same time. If we have the popular vaccination, our people receive the flu vaccine at a very high rate, I think we can reduce a lot of work to differentiate the COVID or flu. So that we also prepared a lot of the antiviral for influenza. If the people have any respiratory symptom, we can give them the antiviral antiviral first. If they subside, we can conclude they are infected from flu. We also trying to buy some antiviral for COVID-19 and the vaccines. I think that's the main work we are doing now.
Do you have a timetable for rolling out the flu vaccines in Taiwan? Because I know if you start too early, it's not helpful because the vaccine may not last through the season. So do you have a campaign that you're beginning on the flu vaccine so that people don't get very, very sick in the fall?
I think we will begin it about 1.5 months before the mass immunization programs. So we will begin at the early October immunization program early October. So we will give the education after the late August. And we will give a very strong educational program.
Do you have the issue of dealing with anti-vaxxers, people who do not believe in vaccines in Taiwan?
The anti-vaccination, Taiwan have some, but comparing to Western countries, they are minimal people, they are just a minimal. And we also have a strong support from medical society. I think when people say something about the anti-vaccinations, I think lots of medical doctor will speak out. The vaccination is very important.
So there's a lot of trust, in other words, in what the medical authorities are saying in Taiwan.
So we think the cooperation with the medical society is very important and is the foundation of success of public health.
When you say medical societies, just so I understand, do you mean like the American Medical Association in the US or do you mean something else?
I mean a medical society, including any physicians who work in medical affairs, so including some work for the academic institution or work for the hospital. Not only the medical association, of course, the Taiwan Medical Association is our important partner.
What is your spread rate in Taiwan right now for the disease? I imagine it's quite low.
Could you say it again? Sorry.
The spread rate, the rate of spread in Taiwan, I imagine it's quite low.
I believe it's very low because our testing, although we have very convenient system for testings, and our positive rate is very, very low, lower than 1% of the specimen we test. So we are quite confident that our society is, the spread is must be very low.
Very low. What does life look like in Taiwan now? Is it back to normal? Is everything, children preparing to go back to school and people eating in restaurants, or are there restrictions in Taiwan still?
Actually, no restriction. We educate our people wearing masks and in the public place and wash their hands frequently and keep social distance with others. However, the compliance rate is decreasing now. That's we worried very a lot. And we are considering when the disease stress is increased, the threat increase, we will consider to enforce our people in some place, particularly those in indoor and poor ventilated place. People must wear masks.
I see. So right now everything is open, but people are social distancing and wearing masks, but everything is open. Can restaurants operate at full capacity?
Yes, we don't have limit them. We just ask them to wear masks in the public place and keep social distance as much as possible.
What advice do you have for governments who are struggling to contain the virus, including the United States?
It's hard to say because my suggestion is that how to do it is well described in lots of recommendations in WHO, European Union, and in lots of health authorities. The key is implemented thoroughly. Just a word used by Nike, just do it.
Just do it, yeah. Well, it seems to me that you are an advocate of having a national policy to do that, which some countries don't even have a national policy.
Yes, I support a national policy, but a national policy must leave room for local situations because they must be modify their strategies. But generally, I support we must have a central commanding system. During SARS outbreak, we don't have a centralized commanding system. Local government always fight with the central government, and the people lose orientation, and they don't know how to follow our policies. After that, we amend our Communicable Control Act. So we set up the Central Epidemic Commanding Center. Local government must obey the order from the Central Epidemic Commanding Center.
I have a question from one of our audience members who said, when the general public is skeptical about the strategies the command center adopted, such as not implementing universal testing, how do you respond to this challenge? I mean, how do you deal with a skeptical public?
I think we explained lots of 100 of times during our press conference. We said we have provided very convenient channel for receiving the test. We give the doctors a big room to send the testing and paid by the government. After physicians' evaluation, the positive rate is extremely low. I don't think we make the general screening or testing will find a lot of people. So it's just wasting our money. We would like to concentrate our efforts and resources in the most likely people and screening them.
Right. In a future pandemic, God forbid, what would you do differently? Because last time you said you learned a lot from SARS and you've done a lot differently to prepare for this pandemic. What would you do differently going forward?
I think we will do more about on the information system integrations. It's very important. We found during this pandemic. We also will find we will try to find a new strategy to defeat the misinformations or disinformations. And we found the stockpiling is important, but not only for the medical need. The civil need is also important because every people wear mask can decrease can stop the spread of the virus. In addition, we found that our healthcare system preparedness can be better. And in addition, our business did not have a very good business continuity plan that we will make some change after this pandemic.
Yeah, those are all very interesting points. I want to follow up on a few of them. Let's talk about how have you fought against misinformation during the pandemic? This is a question from somebody in India. So you mentioned that you think you could do a better job in the future, but how did you deal with it this time around?
Yes, we cooperate with the fact-checking institute or whatever. Yes, we cooperate closely with them. And in addition, we respond very quickly and make press conference to clarify the information very quickly. And in addition, we also have the law regulating these behaviors, and we have a law enforcement team to investigate the source of the misinformation and trying to correct them.
Did you have any arrests?
Actually, not arrest. We just find them some money.
I see, find them, yeah, okay. Do you have a strategy for reaching younger people as well on communications? Do you have a social media strategy?
Yes, we use the social media a lot. We use the Facebook, Line, or very other tools that young people like to communicate with them. We also have a partner from university. They can design some very interesting communication tool with the young people that we know to communicate with young people is very important because they always not follow our recommendations. So communicate with them is very, very important.
Yeah, that's a very interesting and good point. What was the other point you mentioned? You said misinformation. What was the other strategy that you would change for the future? I'm drawing a blank right now. Let's talk, it was about workplace that you said the businesses were not prepared. What did you mean when you said the businesses were not prepared for the pandemic? Is that they were not prepared to have people work from home or work virtually?
Yes, and in this time we are a little bit lucky. So most of our business can work as normal, but we don't think we will be always so lucky. So we find some business is not well prepared for their, for example, work home and other regulation is not set not so well. So we have to do more on this field.
Do you have some arrangements with employers? Are you partnering with employers on this issue or on providing tests to employees during work hours and things like that? I know that you're not testing that much, but what kind of collaboration or what kind of partnerships are you working with private enterprise to make sure that employees are safe when they go back to work?
Yes, we cooperate with some business, and we make help them to know how to keep their business going well. But I found, in Taiwan, some are small business, and they are not easy to follow the strategies we suggest. So we have to find a model for particularly the small business, and to make them can have a good cope with the pandemic.
Let me ask you about journalists. Do you think journalists in Taiwan did a good job of covering the pandemic, or are you disappointed in any way?
They did a very good job. They supervise us very closely, because we have a press conference. Although it's hard time, but we face it. We found it very important. They have lots of questions. They have lots of criticism, but we have to explain to them patiently, let them know, because we strongly believe they are our good channel to communicate with our people. Actually, journalists in Taiwan did a very good job. They are very strict to us.
You don't hear that so often from government officials. So it's nice to hear that they did a great job, and that they're also working hard to scrutinize what the health authorities are doing and ask the hard questions, because I think that does build public confidence if you can ask the questions and governments and can respond openly and candidly to them.
Mm-hmm. Yeah, we have to face it. I think the Taiwan CDC have a very collaboration relationship with journalists, because we receive the criticism. We found they are good. One of our strengths to put us go forward.
I wanted to go back to the beginning of the WHO. I know Taiwan is not a member of the WHO because China is not allowing Taiwan in. What is the status now? Do you think in the future you might be allowed to enter the WHO, or do you want to?
Yes, I think we will still keep going on to and try to join the WHO, because we think we can work, we can contribute to other people. We have to learn from other countries. That's important to us. Based on our own business experience is not enough. We need to inspire other people's experience. That's very important to us.
Are you getting any signals that might be possible?
I don't think so. I don't consider these questions, because I told you, we will just do it.
Just do it, right? I do have a question here that is similar to one I asked before, but do you have recommendations for developing countries that do not have the infrastructure Taiwan has? What recommendations would you make to those countries that are poorer without the less sophisticated healthcare structure? They still cope with the disease. So what would you say the priorities for them should be?
Yes, for developing, I think infectious disease control can be achieved without the high tech, because if we can if we can keep people cooperate, we have good surveillance system. If people suspect that they have the case, they are infected, they can report, and they do it, respond very quickly and thoroughly, and make sure the isolation or quarantine in place. I think it will enough.
Right. Well, this was terrific. We're finishing up a little early because I thought we were talking through a translator, but your English was absolutely wonderful. And
Really, thank you. You're nice people. I can
And-
speak this really well now.
And we're really happy that you shared your successes with us. There is so much to learn from the Taiwan experience, and congratulations on doing an amazing job during the pandemic. We would love to have you come back in the fall to tell us, you know, how you're dealing with the situation if it does, if we do have a flu outbreak and a pandemic at one time. It would be really interesting to look at the Taiwan example again, because I have every confidence that you're going to conquer it and deal with it very effectively. So congratulations on that.
Thank you. We will do our best to guarantee the health of our people.
Yeah, that's great. I just want to also, before I close, I want to remind journalists to fill out the survey we sent you about the webinar. Our feedback is very important. Also, we'll be putting this this discussion on our YouTube channel, so feel free to share that as well. And we are soon going to be coming out with a survey on journalism and the pandemic, so keep your eyes on that. We are going to look at the effect that the pandemic has had on journalism around the world. So Dr. Chou, thank you again very much, and we hope you'll come back and talk to us again in a few months.
Thank you.
Thank you.
Thank you.